السلام عليكم ورحمة الله وبركاته. محاضرتنا لهذا اليوم هي الإكسترا أورال راديوغراف. Extra oral radiograph examination include all views that made for orofacial region with film position extraorally. The dentist often use this view to examine area not fully covered with intraoral film or to visualize skull and facial structure. Purpose of extraoral radiology. Number 1. To examine large area of the orofacial structure, study growth and development of bone and teeth, detect fracture and evaluate trauma, detect pathological lesion and diseases of the jaw, detect and evaluate impacted teeth, detect TMJ disorder. Extraoral radiograph technique include panoramic radiograph, lateral jaw projection, postero-anterior, lateral skull, cephalometric radiograph, Waters view, reverse town, submentovertex, temporomandibular joint projection. The first one is lateral jaw projection. It includes true lateral projection. This projection shows the skull vault and facial skeleton from the lateral aspect. The image receptor is positioned parallel to patient mid-sagittal plane. The site of interest is placed toward the image receptor. Image receptor, I mean the film, to minimize distortion. The film is adjusted so that the upper circumference of the skull is half inch below the upper border of the cassette. The central ray is directed perpendicular to the cassette and the mid-sagittal plane and toward the central auditory meatus. This is the lateral jaw projection, and this shows the patient position. Indication: fractures of the cranium and the cranial base. Middle third facial fracture to show possible downward and backward displacement of maxilla. Investigation of the frontal, sphenoidal, and maxillary sinus. Condition affecting the skull vault. Paget disease, multiple myeloma, hyperparathyroidism, condition affecting the sella turcica, such as a tumor of pituitary gland in the acromegaly. Cephalometric projection. Cephalometric projection are standardized projection for imaging of the craniofacial region and made with cephalostats, which help to maintain a constant relationship between skull, receptor, and the X-ray beam. Cephalometric projection is made with long source to object distance about 5 feet. This large distance minimizes image magnification. The object to receptor distance is typically 10 to 15 centimeters. These projections may be made using film or digital receptor. Indications: evaluate the intero-posterior relationship between maxilla, mandible, and cranial base. Assess skeletal and soft tissue relationship. Monitor progress of orthodontic treatment and treatment outcomes. Proceed with orthognathic surgical treatment planning. This picture shows the cephalo projection, and this is the anatomy that we can see it in the cephalo. This is the device and cephalostat. Lateral oblique projection for demonstrating premolar molar region and inferior border of the body of mandible. Head tilted toward the side to be examined with mandible protruded. Film is placed against the patient cheek and centered over the first molar. The lower border of the cassette should be parallel to the inferior border of the mandible and at least 2 cm below it. The X-ray tube 2 cm below angle of mandible directed toward the first molar region of the cassette side. Indication: position of impacted third molar, fracture of ramus, condylar or body of the mandible, but not symphysis or midline. This is the oblique lateral projection, and this represents the patient position. Postero-anterior of the skull. This projection shows the skull vault, primary, the frontal bone, and the jaw. The image receptor is placed in front of patient, perpendicular to the mid-sagittal plane and parallel to the coronal plane, so that the canthometal line is perpendicular to the image receptor. Central ray is directed at right angle to the film through the mid-sagittal plane through the occipital bone. This represents the patient position. Indication: a fracture of skull vault, investigation of a frontal sinus, conditions affecting the cranium, Paget disease, multiple myeloma, hyperparathyroidism, and intracranial calcification. Postero-anterior of the jaw or mandible. This projection shows the posterior part of the mandible. It is not suitable for showing the facial skeleton because superimposition of the base of the skull and the nasal bone. Indication: a fracture of mandible involving the following site: posterior third of the body, angles rami, low condyle neck, lesion such as cyst or tumor in the posterior third of the body or ramus, to note any mediolateral expansion, mandibular hypoplasia or hyperplasia, maxillofacial deformity. The patient position the same as postero-anterior for the skull, but the patient open his mouth. Waters projection. The image receptor is placed in front of patient and perpendicular to the mid-sagittal plane. The patient head is tilted upward so that the canthometal line forms 37-degree angle with the image receptor. If the patient mouth open, the sphenoid sinus will be seen superimposed over the palate. The central beam is perpendicular to the image receptor and centered in the area of maxillary sinus. This is the Waters view, and this is show the patient position. Its indication include evaluation of maxillary sinus, evaluation of a frontal sinus, a view of orbit and nasal fossa. Reverse down. Observe the occipital area of the skull, neck of condyle process, film positioning cassette perpendicular to the floor, position of patient, back to patient head, touching film. Central ray should be 30-degree to canthometal line. It is primarily used to observe the occipital area of the skull. The neck of condyle process also be viewed. This represents the patient position and the image. Submento vertex projection. This projection shows the base of a skull, sphenoidal sinus, and facial skeleton from below. The image receptor is positioned parallel to patient transverse plane and perpendicular to mid-sagittal and coronal plane. To achieve this, patient neck should be extended as far as backward as possible, with the canthometal line forming 10-degree angle with receptor. The center beam is perpendicular to the image receptor, directed from below the mandible toward the vertex of the skull, and centered about 2 cm anterior to line connecting the right and left condyle. Indication: destructive expansive lesion affecting the palate, pterygoid lesion or base of skull, investigation of the sphenoid sinus, assessment of the thickness mediolateral of the posterior part of the mandible before osteotomy, a fracture of zygomatic arch to show this bone. The submental vertex is taken with reduced exposure factor. As we seen in this picture, the left zygomatic arch are fractured while the right one is still intact, and this represents the patient position during exposure. Temporomandibular joint projection, also called TMJ tomography, help in visualization of the condyle, articular eminence, and glenoid fossa. It can be also used to determine the joint space and to evaluate the extent of movement of condyle when the mouth is open. We have three types of temporomandibular joint projection: transcranial, transorbital, transpharyngeal. Each view can be taken with open and closed technique, as we seen in this picture, and this represents a patient position. Canthomethal line means the line that connects between the lateral canthus of the eye with the external auditory meatus. This picture shows the mid-sagittal plane, which is represented by a blue line. Frankfurt plane. This plane is connect between the orbital and the superior point of the external auditory meatus. Thank you for your listening.